back to Good Morning San Diego, 6:45 on your Monday. Good morning, La Jolla. The opioid epidemic is tearing lives apart across this country. Probably somebody you know is dealing with it. And Scripps Health is making the first step and making it available to you to fight back. Joining us to talk a little bit more about this new program, Lisa Thakur from Scripps, the Senior Vice President, Ancillary Operations. Good morning, Lisa.
Good morning.
All right, so first of all, let's lay out the problem. Opioids, you know, people think that it's, drug addicts on the street, get addiction to heroin or opioids. But that's not what's happening here.
Well, first of all, 75% of heroin users started with using opioids.
What is an opioid?
It's narcotics. So a lot of times it's used for pain management, and that's quite often people who get addicted to opioids start off with surgery, actually. And so our program is actually starting with our surgical patients, because what we find and what studies have shown is that quite often it starts with surgeries, and it can be any type of surgery, even a simple like carpal tunnel surgery, and afterwards they become dependent on those opioids.
Okay, so let's talk about how this all happens. So lots of us have had to have a surgery or had some sort of medical procedure, or perhaps you're in pain on your shoulder or your back, and you get prescribed some sort of painkiller, Dilaudid or something, maybe not even that strong. But then you become hooked, and people don't understand that the potency of those pills.
They don't, and they have shown studies that after 3 days post-surgery, if a patient's still using opioids, the percentage chance of being dependent on opioids increases significantly.
Oh my gosh, after 3 days?
Yes. So there's been a couple of states actually that have actually put in state laws that say post-surgery that physicians can only prescribe 3 days before they have to come back to their physicians.
How much of this is also education for patients themselves? How much of it do the people who go in who have surgery or go in because their kid's broken arm or what, how much of it is they need to say, wait a minute, what are these pills? What's it going to do to me in the long run? Well,
and that's why the first start for our program is actually patient education and physician education. So the patient education is understand the risks and complications of using opioids. And the complication rates are much higher for those patients who use opioids, and there's a lot of other treatments. And then also tapering off if they're using opioids and how fast to taper them. In addition to, they've also shown that physicians are over-prescribing in general.
Right.
And so
how do you stop that?
Well, we have education for our physicians that we're rolling out now, and it's going to go to every single physician on our medical staffs that talks about the importance of kind of limiting as much as possible the number of prescriptions that we're giving. So even children, when our teenagers, when they get their wisdom teeth pulled out, a lot of times you can get 30 Percocet, which is not necessary. So and we're setting standards, working with our physicians to establish standards of how many opioids for specific types of patients. If you're going to prescribe opioids, how many should that be? And ensuring that physicians are educating their patients on, first of all, the goal is not to be pain-free. The goal is to have the quickest and recovery with the least complications.
I think that's a key point, because I think a lot of people in this day and age are like, just give me a pill and make it go away. But what they don't realize is by taking that pill more than 3 days, yeah, you might be taking that pain away in the initial stages, but on the backside, you're going to have an opioid addiction, which perhaps could turn into a heroin addiction, which is how we see this progress and what the problem is, and that's what's killing people.
Yes, and on the heroin, because a lot of these people are starting with opioids with a surgery, and they get addicted to opioids, and then when they can't get those prescriptions anymore, they're turning to heroin. This is affecting families across the country.
And it's real. It's not like this is made up.
Well,
this is not fake news. I mean, this is real.
There are 530 Americans every week dying from an opioid overdose. It's more than from car accidents. 1 in 25 Americans is addicted to opioids.
Is there a way, Lisa, when people go through a surgery, and ahead of time when they're having a conversation with their doctor about their post-surgery progress, is there a way for them to say, you know, doc, probably I don't need 30 Percocets or
Yes.
30 Dilaudids. I don't need that.
We're having more and more patients who are getting educated themselves, who are telling their physicians exactly that. Don't over-prescribe opioids.
Yeah.
Plus, the education for physicians up front on other
can't do
types of what we call multimodal pain management. So there are other things that can be prescribed in other ways in order to reduce the level of pain. But eliminating pain completely and being pain-free is no longer the goal.
Right.
If you have some pain, sometimes that's good because maybe post-surgery, for example, you have a little bit of pain because maybe you're lifting something you shouldn't be doing. It's a way of your body telling you that maybe you're overdoing it.
Right.
And then it just, you also have higher risks and complications the more that you use opioids.
So the program, like you're saying, the program that we're talking about
Yes.
today is going to start within the Scripps kind of
Yes.
surgery with your own physicians, but ultimately, I believe this would be very beneficial for
We want to take
everybody.
this out to the entire community.
Right.
So we're going to start with our patients. We're starting with our physicians and rolling that out across the Scripps system, and then we're going to start to get out into the community. And we really want to educate the entire community about how critical this is and how easy it is. So easy to become opioid dependent, and people just don't realize that until they find themselves in that situation. And then one of our future goals as well is to really work out there in the community for those who are already opioid dependent and try to help them to taper off and to look at other ways of managing their pain.
Right. I mean, because let's just kind of touch on that part real quick before I let you go. Because once you become opioid addicted and you can't, for whatever reason, get your hands on the prescription and it turns to heroin or it turns to something else, what does the recovery from that look like? I mean, are we talking rehab and serious withdrawal? What does that look like?
So then you have rehab and withdrawal and so forth. And so that's one of our first goals is to start with the prevention. So we want to first start with the prevention and the education, so we don't have as many people falling into that trap, and then to help those who are already opioid before they become the heroin users and fall into rehab and so forth.
All right, so number one, ask questions.
Absolutely.
Do not just take 30 Percocets because you want to get rid of the pain. And number two, the goal is not to be pain-free.
Exactly.
But to be better and healthy.
Yes.
But not pain-free.
Yes.
That leads to a lot of other problems.
It does.
All right, Lisa, thank you so much for your time this morning. I really appreciate it. We'll put all the information about this program on our website, KUSI.com.
Okay, thank you.
All right, we'll be back with more Good Morning San Diego right after this.